Once again, Diane Sawyer.
As we investigated VA hospitals, patients told us over and over again that one of the biggest problems was a kind of assembly line, how the patients are handed off from doctor to doctor, sometimes causing them to miss key facts about diagnosis and care. And what about the doctors themselves? Well, the VA hospital is the major employer of what are called residents, those still in training who've not yet been certified in their specialty. It saves a lot of money. The residents are supposed to be supervised by senior physicians, but are they always?
This is Dr. John Wade Schaefer, who is paid $100,000 a year as an orthopedic surgeon at the Cleveland VA. On this day, we show up early at his gated community in Aurora, Ohio to watch because he's scheduled to supervise 2 different surgeries, one on an arm, the other on a patient's hand. At 7:30 in the morning at the VA hospital, the residents are already scrubbing in. But Dr. Schaefer, 40 minutes away, has not even left his house. 9 a.m., he still hasn't left the house. His wife emerges on her golf cart to take out the garbage. 10 a.m., the residents have done the first surgery and moved on to the second one at the hospital, yet Dr. Schaefer is still at home. Finally, at 11:40, after the residents have finished both operations, Dr. Schaefer emerges in his car, but instead of going to the VA, heads to his office for a full schedule of private patients who pay him on their own.
So Dr. Schaefer is booked today?
Yes, ma'am.
Nothing at all?
No, ma'am. He's completely booked. He's double booked and triple booked at some spots.
Well, that would be an unfortunate situation if someone is not where they should be in VA during the time they're meant to be paid. That is not the typical.
And hospital records obtained by Primetime show that in 2003, Dr. Schaefer was scheduled to be the VA's attending surgeon on 123 surgeries. But he was only in the VA operating suite 11 times, and in the actual operating room just 4 times. That would not be allowed at other teaching hospitals, but it might surprise you to know that it's okay under VA guidelines, as long as Dr. Schaefer is somewhere on hospital grounds. And when we called to ask him about that day we observed him at home, he told us that it would be a violation if he was, in fact, at home that morning, and that he doesn't know why he was at home that day. Perhaps, he said, it was a glitch. He added that he's a veteran himself and does care about VA patients. But a 2003 Government Accounting Office report stated that VA procedures for monitoring resident supervision are insufficient, and not just for surgery. When we take our hidden cameras to Cleveland's orthopedic outpatient clinic to ask to see the senior doctor on duty, we're told he's not actually there.
Can you see him?
We're told we could see a resident. But where was that senior doctor paid by the VA to supervise the residents?
I've never seen him. I wouldn't know who he is. I only see the residents. The doctor don't. He usually not here. He be in other parts of the hospital. Or he could be in another hospital. That's how they work.
Mark never met his head physician at the VA. Never met him. Out of 13 years.
Consider the case of Mark Wilson, who won 18 service awards in the Air Force in the Gulf War. He was treated by many resident doctors, and his wife Pam says not one read his lab report diagnosing a potentially fatal lung disease. For 5 years, they treated him for the wrong thing.
You see a different doctor every time. And a lot of times when you go in, they don't have your records from one time. They never look at your records from previously.
Mark Wilson died, and the VA has admitted that they did not treat his illness properly. Pam is filing a lawsuit. She says that was assembly line care, and her family is paying the price.
You know, it's like you go from having wonderful children to having a child that is so angry because somebody took his dad away. That you can't live with it.
And it's not just that some senior doctors don't supervise residents as much as they should. The residents are rotated in and out of departments every 3 to 4 months, creating what some people feel is a potential danger in trying to diagnose and treat disease. Chuck Amedia, who flew reconnaissance missions during the Gulf War, says the VA residents he saw put him in a wheelchair and wrote him off as disabled for life.
It was like, okay, Mr. Amedia, you're sick. Go home and learn to live with it. We don't know what to do with it. There's nothing else that can be done.
So he and his wife used their own savings to pay for private care, and the doctors discovered that, in fact, he had a reaction to a chemical exposure. He was treated, and today he can walk.
I had to leave the VA system because nobody was listening.
Eric, happy birthday, buddy. Happy birthday. To be another.
Happy birthday, Grandpa!
But no story we heard was worse than that of this man, 6-foot-tall, physically vital Terry Souls, who served in the Navy during the Vietnam War.
Happy birthday to you.
A 52-year-old father of 5, he first went to the Cleveland VA in 1998, suffering intense pain and diarrhea. He needed tests that he couldn't afford to get in a private hospital. The VA found a small cancer in his stomach and esophagus and removed it.
And said they had got it all.
The doctor said that he was free of cancer. She says no follow up with chemo or radiation. He's cancer-free.
But over the next 2 years, he returned to the VA as his symptoms persisted, and his wife says he was given painful tests, while the VA repeatedly lost the results, and he had to do them again.
You would see one doctor 1 week, and maybe 2 weeks later you'd see another doctor, and they were wanting to give him the same medication that maybe a doctor a month ago gave him that didn't help in the first place. So
and even as surgery was about to begin, she says, doctors once debated and couldn't agree on what they were going to do.
Terry says, if they're not that sure, at this point, they're not putting me under there. And when we questioned the doctor says, I guess we need to all get on the same page in the operating room.
At the same time, she says the VA kept telling her husband his pain was psychosomatic.
I mean, you know, to say that a man that had been 221 pounds was at 115 pounds at one point, that was a stable weight. That's not a stable weight for a man of almost 6 foot tall.
With sores all over his body, Terry Souls wasted to 80 pounds. Suddenly, he couldn't even recognize his son. So his wife called 911. An ambulance took him to a private hospital.
They had done a CAT scan, and the doctor told us that he was a total mass of cancer from his trachea to his renal valve, and that there was nothing that could be done.
And when Terry Souls finally heard the terminal diagnosis, a surprising reaction.
He smiled and he looked at my son and I, and he said, I'm not crazy. There was something wrong with me.
Once again, we're back with Deputy Undersecretary of the VA, Dr. Perlin. We had alerted the VA before this interview that we wanted to discuss the case of Terry Souls.
I'm sorry, Ms. Sawyer, I do not know the details of the case.
Oh, you don't know this case?
No,
So we told him the story of the case in which the VA officially admits, quote, in this case, the veteran's death was a result of inappropriate treatment at the VA Medical Center with lack of follow-up.
That sounds tragic. However, that is not the experience of most of the veterans who come to us for care.
So this is just one incidence? You don't know of any others?
This is a big system. We take care of 7 million veterans. While the majority of care is good, in a big system, bad things happen.
We'll tell you more of VA reaction later.